So, yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonics Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
fu muy fanaan ak kuy wut ku ko wétali xanaa delloo buntu gi warul na boole Ria Fatus Guest House tijjil na leen buntu bi ñu leen fa am ak ñaari cabinet salle yu yaña
amal leen li nga xamantene mooy cabinet ak salle ñu ngi leen amal AC ak fan
salle bi nag lépp li ngeen soxla am na fa sofa yu nooy ñoo fa nekk TV bank fa cabinet boo dugga lal yu nooy leen fa amal nañ leen fa AC ak li nga xam ne moom mooy fan toilet yu set wicc amal nañ leen fa kitchen microwave fridge and room bu baax dama ne teranga day mut motax Ria Fatus Guest House amal len extra kitchen lepp lu ngeen bëgg togg mën ngeen ko toggé ci gas ku cabine
kuy xalam di ci jaayu nak barke bi yaay borom amal ne li nga xamantene moy ndox ak courant 24/7 bu len tiit bu len ragal bu len xof ndax amal ne li di CCTV camera
set ci lañu ci Farafeñe gannaaw garage ci basse bi Kawur highway
very clean every day amna cleaning service ratio bi amul fedd
Ria Fatus Guest House teranga aduna beut kon nak set ci lañu
The Honorable Minister of Health, Honorable Lamin Samate, the WHO country representative, the Director of Health Services, Director of National Pharmaceutical Service and team, and WHO team that are here, the media. We also have colleagues from the Ecowas. We are also country director of Ecowas and the country director, and then the team that are also here. We have colleagues from the media, and we also have Mr. Omar Balde, who is also the Director of African Affairs at MOFA, Minister of Foreign Affairs. We want to welcome you to this important handing over, where we are witnessing the handing over of test kits provided to WHO, to the South Korean government, and this gift is coming to WHO, and these are test kits and as well as extraction kits. These are the burnt materials you are seeing behind, and we are witnessing the handing over. So from here, we will also move the other way to also witness the handing over of Wahoo support to ECOWAS, which is also some test kits and as well as PPEs. So we have two handing over here, and then we move to the other side, which is going to be the third handing over. And you will also stay around for a bit, few minutes, then we also do the press briefing with regards to the country being declared as a country that has eliminated trachoma in this country. So we have 3 events here, 4 events, I would say, so you have to bear with us today. So we'll keep you here for a while. So I now invite the WR to give a statement on this handing over of the equipment. WR did nice job.
Many years, I don't know how we handle it. I noticed that a long time ago. Yes. Yes, someone has to. Good morning, everybody. First of all, thank you very much, Odunjay, Director of Health Promotion, for giving me the chance to speak first. And I would like to recognize also protocol. Honorable Minister of Health, Dr. Ahmadu Lamin Samate. Honorable Your Excellency, the Ambassador of ECOWAS, and the dignitaries present here from the ECOWAS, from partner organizations, from Ministry of Foreign Affairs, and the Ministry of Health officials, and Dr. Biti, also Director of Health Services, and Mr. Sabali, the Director of Pharmaceutical Services. All protocols observed. Today, we are just witnessing one of the things we usually do. As you know, we are handing over some items, but before I go there, I would like to just say a few things regarding the COVID response globally and also in the country context. Currently, I think the world is still battling with COVID-19 pandemic, with the weekly number of cases still increasing in some countries substantially. You have noticed these days that India is badly hit with the wave of the COVID-19. And so it shows us that the game is not over yet. Although we have vaccines at hand, we still have a lot to do. So this upsurge in the number of cases is quite significant. So countries should continue preparing their systems to respond to any event that may give rise to increased number of cases. In Africa, it's not different. In Africa, there are some countries that are registering a reduced number of cases, but there are several that are actually coming up recently with increasing number of cases and deaths. And this is partially attributed to the new variants of the virus, and which is much more faster in the getting transmitted to other people. And also in some cases, severity of the disease is also much worse compared to the previous ones. Gambia is doing actually remarkably well, particularly at the beginning of the outbreak. For the first 4 or 5 months, we are really doing very well. Then we are hit with the first wave around July and August. Then we got better. Now we are experiencing also again another increase. So, but we are still up to now, we are not really up to very serious situation that results into collapse of the system. So we are doing well. But we have to prepare and do better as we go along. And in this regard, we need a lot of support from different partners, and government is doing also its part. And then this, what you see today, is just part of that support that we want to provide to the Ministry of Health. And by the virtue of our nature also, as a global institution, we have been also partnering with global partners, member states, who are willing to extend their hands. And in this event, the Republic of Korea, correctly, I think the correct name is the Republic of Korea, has partnered with WHO to provide testing kits for Gambia worth $200,000 US, which are here actually with us. And also, I think some parts of the donations that were coming from Ecowas also were routed through WHO office. So we have received about 25 boxes of lab reagents that came through our office, but which were not originally, were supposed to be. So the other part is actually equipments, which are ventilators, which are critical in the management of severe cases. These big boxes that you see here with different types of, some wooden boxes. These are heavy equipments for ventilators. There are 4 of them. These are worth about 100,000 for the bigger equipments, but we don't have the cost for the parts, the spare parts that needs to be replaced. We have also parts here. So this is the donations that's coming from different routes. And at this juncture, I would like to note that what we have received is about 15 million Gambian dollars worth. And I would like to express my sincere gratitude and appreciation to the people and the government of the Republic of Korea for their kind gesture. This is not the first time the Republic of Korea has been assisting the COVID response. We have received globally, I think actually WHO has received several support donations, particularly with test kits, which actually benefited many countries around the world. So we are very grateful for this donation from the Republic of Korea. At the same time, I would like to also recognize partners globally who actually forged solidarity and supported countries through WHO and other institutions that are active in the response. And of which I think you see even the ventilators are coming through that support. So it's global solidarity. So I think the message I get from all this is actually the only way out of this pandemic is through solidarity. We need to support each other. We cannot make it by ourselves. And this is a message that actually WHO is echoing repeatedly. We have seen it actually, the vaccine nationalism. Some countries don't care. They are actually increasing the number of people that will be vaccinated, even outside the priority group in their territories, without taking care of others who are falling behind. Others who are in the priority group have not yet received in many countries. But thanks to the COVAX facility, many countries have started receiving the vaccines, and we hope the situation will change. We are strongly advocating against that. Then what I would like to say at this juncture, while concluding my remark, is thanks to all who are in the front line, who are responding against this pandemic to save the lives of their community. And thanks also to partners who actually came forward to support countries in the response. And thank you for your solidarity. At the same time, I would like to thank also the Ministry of Health, particularly Honorable Minister, who is always, he wakes up early in the morning and gets to home very late in the evening, every day, without getting tired. I think being a surgeon, I think must have for you, because you are always there on call. So we really appreciate your leadership and commitment, which is actually bringing also strengthening in the health systems in different respects. He has also a wider vision beyond COVID. That's very, very important, because COVID is one of the problems, but we are going to face more from other health threats. So seeing wide, preserving the essential services, and making sure that people get quality services in all the facilities that we are having around the country is very, very important. So thank you very much for your leadership and focus on this, Honorable Minister. And going forward, just a reminder, we have new variants of the virus, which may not be amenable to some vaccines, or if it is amenable also, it reduces the efficacy of the vaccine. The effectiveness of the vaccine will be reduced. But the only proven way that will take us out from this pandemic is the usual tested public health strategies. We have to do the testing as soon as possible. All those symptomatic people have to be tested. Those who are positive should be isolated, and those who are contacts of the cases should also be quarantined. If we don't do that, the transmission will continue and will continue. And with the new variants, we don't know where we are heading. It may even actually, we may lose even the gains we have made with the vaccines, and the vaccine may be rendered even ineffective with the new variants. So controlling the transmission is very, very important, that we have to really pay attention. And I would like to also to assure you, Honorable Minister, that WHO, together with all partners like Ecowas, WAHO, also UN agencies here, and other partners who are supporting the response, including the private sector, we are here with you until the end, until we are done with this pandemic. So our support will continue. This is not the last. And my message to the general public is, please, if you are symptomatic, get tested for COVID-19. Knowing is better than ignoring. If you know your status, you can protect your community and your family. But if you don't know, you will transmit and you will really cause more harm. At the same time, we have vaccines also, which are offered by the Ministry of Health to everybody. But the turnout looks not very forthcoming, so please go out and get vaccinated. It will help you and your community in fighting against the virus. With that, I thank you very much for your kind attention. Thank you.
WR for that excellent statement, emphasizing on key messages, which really I also want to re-emphasize again. He has asked for the need for support, for us to support each other during this pandemic, which is really necessary. And he has also asked for people to be tested. And I think it's important that we need to be tested, and also for people to be vaccinated. So we need to, these are the key messages that we need to take home. As media personnel, we also need to get this message out to the public. When we talk about test kits, we know that it has to do with the lab. So I also want to recognize the presence of the Director of National Public Health Laboratory and his team, and also the Deputy Director of National Pharmaceutical Services and her team that are also here together with the Director. On that note, we can now allow WR to do the symbolic handing over. And the curtain, which is the light, the one that is a bit light, okay. Can you get pictures now? Can open you. Okay, no. Let's stop doing marker. Let's stop doing marker. Because I want to do some pictures for our.
Thank you very much. Thank you. The Ecowas ambassador to the Gambia and her entire team here present, the WHO country representative and his team here present, the officials of the Ministry of Foreign Affairs, the Director of Health Services, the Director of National Pharmaceutical Services, the Acting Director of Laboratory Services, National Public Health Laboratory, and with all your team members here present, the ladies and gentlemen of the media who have been our partners throughout the journey, all invited guests, distinguished ladies and gentlemen, we stand here before you once again to receive these very useful items from our partners in our efforts against COVID-19 in this country. Today we stand before you to receive the items that are being donated by the World Health Organization, WHO. In addition to that, the additional items donated by the Republic of Korea through the WHO to the country. The COVID-19 pandemic is still ongoing. We have seen surges in various parts of the world. It is still killing people, so there's no room for us to be complacent. We still need to give it the seriousness that it deserves. Certainly, the government of the Republic of the Gambia is giving it that seriousness, and together with our partners, we are giving it that seriousness in not relenting in our efforts to deal with COVID-19. So the COVID-19 response is even stronger today than before. Day by day, it gets stronger in the sense that we learn more about the disease, in the sense that we are better equipped every day. We have received quite a number of life-saving equipment on the grounds here in Kotu. Today, we still receive a set of life-saving materials, including ventilators and a comprehensive system that helps these patients breathe, and that helps these patients get in oxygen when they are in crisis. I think that is very, very important. Now, as the WR had said earlier, for us to deal with the disease effectively, people need to know their status. Symptomatic patients need to be tested, and their contacts need to be followed up. It is a public health issue. When we know that this disease is transmissible, it's a communicable disease, we are able to identify an index case early enough. Because if we don't do it early enough, that means there is room for more people to get infected. We identify that early enough, isolate the person, give the individual the treatment that he deserves at any of the centers, and then the contacts are traced. By so doing, we will be able to, inshallah, contain the disease. So this is the strategy. So the testing is very, very important. Now, our testing ability is being strengthened by the day. You would have remembered that there were days that we couldn't test in this facility here. But with our partners, and under the leadership of the head of the National Public Health Laboratory, Mr. Sirifo Jany, and his entire team, they endeavored to make sure that we are able, and MRC, of course, we thank them. Mr. Jany and his team endeavored to make sure that we are able to test these patients in our facility in the Gambia now. I think it has been a big plus, and they deserve a big round of applause for that. Testing still continues. Their capacity has been increased. Their experience has been increasing by the day. However, we need a consistent supply of test kits and the other accessories needed for testing. And here we are today, again receiving a huge number of those test kits to make the work of Mr. Jany and his team easy. We say thank you very much to WHO and the Republic of Korea for that. Coming back to the COVID-19 response, yes, COVID-19 has been a challenge, a big challenge for the entire world throughout. It has been a difficult 12 months and beyond, 18 months or so, or 17 months since the discovery of the new coronavirus disease sometime in November 2019. A lot has happened, a lot has been said, but a lot more is known about the disease. But at the forefront of the whole response has been the healthcare workers. And at any opportune time, we certainly want to acknowledge their efforts and thank them very much for holding forth, for standing by their people during these trying times to deal with COVID-19. And we give a big round of applause to the health workers. The government of the Gambia takes the healthcare of its people very, very seriously. It is one of the highest items on the agenda of His Excellency, the President, Mr. Adama Barrow. He doesn't relent. He's shown remarkable leadership during the COVID-19 pandemic, and he's still showing that. He's very much au fait with our strategies, our response, and what we are doing. And he has been very, very, very supportive, because without a supportive leadership, there's hardly anything we can do. And that support has been forthcoming from the beginning, and it is still ongoing. The commitment of the government has been high. The dedication of the team, the entire team of the Ministry of Health, has been unprecedented. The dedication and commitment of our partners has been unprecedented. We have been with them throughout. We attend meetings. WR was talking about me, but I can tell you many of those evenings we spend it together meeting over a whole lot of important things. Meeting, supporting our technical people. Because we could have said, yes, let's leave it with our technical people, but we said at least our little contributions will also help our technical people. And we sit with them until very late in the evening, at night, when everybody is gone home. We are in the offices putting together our strategies and analyzing where we are doing very well and where we need to improve. We thank you also, WR, and your entire team. Thank you very much. But I think this is all possible. Why do we think we are receiving all this? Yes, the partners want to help us, but I think they've seen that where they are putting their efforts and their resources, it is worth it. Because they are very vigilant. They want to see whether the country is serious, and they've seen that we are very serious. They want to see whether the resources they are putting in are going to be judiciously used. And I think they have attested to that, they have seen that. Nobody wants to be given to people or a place where things get wasted, where they are not bothered. So I think this is a very big recognition of the efforts, the seriousness of government. That is why partners are coming in and they want to support every day. In fact, they keep on asking, where can we support you? Whenever you see partners doing that, that means they think they have good partners in the government of the day. And we thank the entire government and the people of the Gambia as well for that steadfastness. Thank you very much. We know there are a lot of activities, but we'll be moving on to another presentation soon. This is just an example of what I was saying. There's a lot of goodwill, and together we will use the COVID-19 response, the experience gathered from it, the resources obtained from it to strengthen the healthcare system of this country. In fact, the amount of equipment we got during this period is unprecedented. And we are on the march. We are renovating a whole lot of health facilities. We are also building new health facilities. We are also upgrading some minor health facilities to become major health facilities. And in addition, we are bringing in more experts, more specialists to be able to do various treatment modalities, carry out various treatment modalities in the country. But also for sustainability, we are training more and more people in the country. Currently, we just recruited 40 BSc candidates for nurse anesthesia and 40 BSc candidates for midwifery. At the CHN school in Masakonko, we are enrolling an additional 100 candidates, and at the SEN school in Bansang, we are enrolling an additional 100 candidates. So this is all to strengthen the health sector, because with the equipment, we certainly need trained personnel to be able to provide the quality of care that our people deserve. Once again, I thank you for your kind attention.
So we are now ready for another presentation of materials donated to WAHU by EU and Ecowas and UNDP. Okay, GTZ or yeah, okay, GIZ, and then this has gone through WAHU, and then the representative of ECOWAS, the country director, will make a statement and will hand over the material to the Honorable Minister, and the Honorable Minister will also receive them and make a statement. And we have Mr. Babanin Sabali to give the vote of thanks after here, then we move to the next level. So, Madam, I now invite you to give your statement.
ECOWAS, representative of the health sector, present, members of the press. Let's gave reasons why all of this support have been coming. So it was kind of all encompassing. But for us from Ecowas, on behalf of the President of Ecowas Commission, His Excellency Jean-Claude Cassibro, we would like, and the Director General of WAHU, we would like to make this presentation, which is in addition to what we have been doing with the Gambia. Gambia is a member state, and ECOWAS has received substantial support from the partners, to help our member states. And so whatever is being done here has been done in all of the 15 countries, and so Gambia is receiving her due. And this is just to reiterate the commitment of ECOWAS to approach all of these pandemic and challenges as a united front. We would like to at this time also applaud the effort of the champion of the COVID-19 of the ECOWAS community, His Excellency President Buhari, who has magnanimously donated his aircraft that goes from one country to the other to give all of the support as we carry these materials around. I don't have the list here because it's been a while, but I think a symbolic process is being done, so the list has been submitted. I know some of them are swabs. I understand vaccines came and a lot because I was here, my political advisor was here when he came. But we'd like to use the time to also reassure the people of Gambia that ECOWAS is here to stand by them, and we would like to applaud the efforts of WHO, that's also a major champion in the world, and they have really committed to themselves to member states. And ECOWAS would like to continue to say thank you to them. And during this time, we also like to applaud the efforts of the EU, the GIZ, the UNDP, who have all been partners with us in all of these initiatives and undertaking. In the meanwhile, we also like to thank the government of the Gambia for supporting us when we come with this partnership, because there are processes that we need to go through. Sometimes you have to get learning right, you have to go through things, sometimes you have to host the palace, and the Gambia has been ready. Even if they come the last minute, they have been one of the countries that have stood by to make sure that we don't lose. And we want to encourage you to continue in that spirit, because through that we all can be able to tackle this. Because this is all in support of our regional integration effort. Because if one Gambian is sick, he goes to Senegal or he goes to Liberia, the whole sub-region is kind of paralyzed, because we want to have a seamless integration where we can move from one country to the other. So as we approach one country where the success is, we know the other country will take it on. So many people say if anything can be done, it can be done in the Gambia. Because the Gambia, the population is not too huge. And mind you, not because the Gambia population is not huge, but whatever they bring, they gave Gambia her sole due. Whether Nigeria got, I don't know how many million, Gambia gets the same amount of supplies as the other countries get. That's how they do with this medical support. So Gambia has a lot to gain from this exercise. I was looking at a young lady over there, they didn't have on a mask, sitting with her colleagues. I'm wondering, what do we need to do for people to just remember that this is something, this is the new normal. We all have to talk. You press people, every minute you are looking for us to ask us. Can you begin to ask your colleagues, why are you now wearing masks? Yeah, this is you have to help us propagate. You have to help us propagate this thing here. We are the examples. If we do it, the others will follow us. You heard the director here talk about the challenges we are facing. You heard the minister recommit himself to what the government will do. But without our support in the communities and whatever, it's going to be very difficult for us to succeed. So I urge every one of us, let's not get weak. So now they see how the mask on the face, they say you want to bring COVID-19 back. So I know they'll say a lot of things, but let's try our best and make sure we face this menace and see how we can be able to make the gains. Like, look at what happened to us lately. We had a Hadromet international conference here. Gambia agreed to host this conference 2 years ago. And 2020 came. Do you know the amount of guests that were supposed to come here? 450 from around the world. 450 people were supposed to be guests in the Gambia. Look at the impact, what it was going to do for the economy and a whole lot. And we lost all of that because of this COVID-19. We need to get angry with COVID-19, confront it as a menace, and see what we need to do to push it back so that we can all live a normal life again. So please, we appeal to all of you. Let's support one another. ECOWAS is here to support you. Mr. Minister, we say thank you for the leadership. Our regards to the President on behalf of our own President, and to reassure you all that we are here. Whatever we can do to support the process, please be assured that we are here to do that. Thank you very much. Members of the press, we count on you to help us. Please stand by us. Please stand by the Gambia. Stand out the world effort so that we all together can have a future where we can stop all of this. Because the minister, he didn't make me up. He's my brother. Because of this thing, nobody likes it. But we have to try. So thank you very much, Mr. Minister. And
thank you very much once again. Your Excellency, Ambassador Geflo, my own sister, and your entire team from Ecowas Commission, the WHO country representative, and all of you here that we've acknowledged earlier. This is again another very good gesture from Ecowas. The Ecowas community, under the leadership of our leaders, has been working together on a whole lot of issues when it comes to economic and social integration, when it comes to standing by each other at the times of need and at the times of joy. This has been manifested in so many areas, so many aspects of life in this country. As Ambassador Geflo mentioned, since the onset of this pandemic, the leaders of ECOWAS have been in touch with each other. They've been discussing, they've been working together to make sure that, inshallah, this pandemic gets contained in the region. As mentioned earlier, especially with infectious diseases, they do not know boundaries. And it is very, very difficult to stop people from moving around, even if you close all the official borders, which is even very difficult because materials need to move around. People need to continue living. Goods need to continue moving around because people need the goods for sustenance. So even if one were able to close all the borders, official borders, the unofficial borders will still remain because some of the towns are border towns and villages that people move in and out without going through any official checkpoints. So that means if one ECOWAS country suffers seriously from an infectious disease, the likelihood that it will end up spreading to the others is very, very high. And we know that as ECOWAS citizens, many of us have relatives in one country or the other, so they need to move around. So with that point in mind, the ECOWAS leaders thought it is important to tackle this as a bloc, which is very, very important. Tackling it as a bloc means we can deal with it, we can share experience, we can look at which country needs more resources, we can look at which country needs more materials, both human and material resources, so that we can fill in the gap, because again, if one country is affected seriously, all the other countries will end up being affected. So I think it was a very, very good thing. The leaders met sometime last year. There was a summit where COVID-19 was discussed. And we were ably represented by our head of state, President Adama Barrow, His Excellency, and there were other ECOWAS heads of state. And at that point, the President of the Federal Republic of Nigeria, His Excellency Muhammadu Buhari, was selected to head the ECOWAS response. And that was a unanimous decision, and that has been a turning point. And we have seen a whole lot of support from the Federal Republic of Nigeria, where they've been supporting throughout, and during this pandemic too, they've equally been very supportive. As Ambassador mentioned, they provided the aircraft to be able to ferry all these items around the sub-region free of charge. Certainly, when the items got to our own airport too, all the other fees that would normally have applied to other aircraft and so on were all waived, and through the active coordination of the ambassador, the director for political affairs of the Ecowas Commission, and then our foreign affairs team, these were all coordinated, and with our director for health services to make sure that the plane landed here safely and these items were delivered also safely to us. Madam Ambassador, distinguished guests, ladies and gentlemen, we have been working a whole lot behind the scenes with WAHO. WAHO is West African Health Organization. That is the health wing of ECOWAS. WAHO has a very, very dynamic Director General, Professor Okolo. We've been working together very closely. We have had a number of meetings. In fact, the recent one is about 2-3 weeks ago, which is also a very, very useful meeting. And this is not the first time WAHO is supporting these activities of ECOWAS. We had received in the past a whole lot of items to help us strengthen the COVID-19 response. Those have been very, very useful. Mr. Sabali and team can attest to that. They've been very, very useful. Now, in addition to that, we are getting this today. But I must tell you, WAHO pays particular attention to Gambia. They have worked very, very closely with Gambia under the auspices of ECOWAS. We have had a lot of collaborations. They've been supporting with regards to our programmatic areas. WAHO is supporting a very successful program in the Gambia called the Kabilo Obama Initiative. They are supporting the other reproductive and child health issues in the country. They are supporting aspects of the health sector, public health aspects of the COVID-19 response. So the support has been remarkable. Now, in addition to that, WAHO has selected 2 out of the 15 ECOWAS countries to support specifically. There is a general support that goes to all the 15 countries, but 2 countries have been selected specifically to be supported, and that happens to be Mali and the Gambia. So we are very happy that we're expecting that support to strengthen our clinical management of cases. So that support, we are in negotiation, discussions with WAHO, so that we are able to use that support to strengthen our intensive care units at our treatment centers and to put up more intensive care units in various hospitals in the country. So that is coming very soon, and we thank WAHO, and we thank you, Ambassador, and through you, we extend our sincere appreciation to His Excellency Kasibru for his leadership and for making this all possible through your own selves. Today we receive very, very useful items. These items include swab sticks, as you can see behind us, for us to be able to take specimens from patients or from individuals to test them for COVID-19. But equally important is the oxygen concentrator you can see behind us here. Of course, by now, I'm sure all of you have learned quite a lot of medical terminologies. You know what oxygen concentrators are. They generate oxygen out of, or they concentrate oxygen out of the air that is available. So these items could save the lives of individuals who are affected with COVID-19 or who are affected with other diseases. But this goes to show that after COVID-19, inshallah, these items will still remain in the health sector to be used for the management of other diseases. So, in summary, we are receiving a whole lot of items day by day that go to strengthen the health sector of this country. Ambassador Geflo, I want to use this opportunity to thank all of you for this wonderful, wonderful gesture. Thank you very much.
Good morning, Mr. Mbonjai, Director of Health Promotion, Honorable Minister of Health, Dr. Ahmad Lamin Samate, Ecowas Ambassador and the team, WHO country rep and the team, the representative from Ministry of Foreign Affairs, Director of Health Services, Acting Director, National Public Health Laboratory, senior members of staff from the Ministry of Health, the media, ladies and gentlemen, good morning to you all. I always said, once you talk about quality of health care, you are equating it to the availability of supplies. Quality of health services is equated to availability of supplies, where supplies means the basic life-saving equipment, medications, vaccines, diagnostics, and so on and so forth. Therefore, we are once again very grateful to be associated with this handing over of much needed supplies. I start by thanking the Honorable Minister, Dr. Samate, for his leadership and for making time to be here today to grace this occasion. His relentless and his persistency to ensure that quality health delivery system is not only attained in this country, but it's also maintained and is sustained at all times. We thank you for your leadership. I thank Madam representative from Ecowas and her team. Ecowas, from the beginning of the pandemic, has been supplying us with much needed critical personal protective equipment, as well as ventilators and many other critical PPEs. We thank Ecowas, from their leadership to the last person, and all their donors that contributed to this donation. And these include Undp, European Union, and GIZ. We are most grateful to you, Madam, and through you to all the members of the Ecowas Commission. We thank Dr. Desta and her team, that's WHO, World Health Organization, for ever being there at all times. They are not only technical advisors, they went beyond their technical advisory role by providing the most needed logistics for our response. From the beginning of the pandemic to today, we have been witnessing several donations from WHO. And these donations are monies they mobilize within their organization and backed by these much needed donations. Besides that, they use their wide-ranging network to mobilize funds from other partners to buy what is required to fight against this COVID. And one of such is the Republic of South Korea, who has come to our aid through WHO mobilization. And we say thank you, WR and team, and please extend our thanks to people of Korea for this gesture. On that note, I thank the Director of Health Services and all the senior directors and my staff for being here, and I thank the media. One thing I want to assure to all the donors is that items donated today will be put in good use. We'll ensure that we accounted for every item that's been donated to us. We have a very robust system that can track whatever item is donated to us, whatever item we receive at Center Medical Store, from here to the last mile. On that note, I thank you all for coming, and may God bless all of us.
We have all seen scarcity of medical supplies during this COVID-19 pandemic. It has not been easy because, for many reasons, many countries need the same items in large numbers, large quantities. And some of those countries that are manufacturing these items themselves are in lockdown. some of the people who are involved in the production of those items are sick themselves. And some even lost their lives. So it has been very difficult. So sometimes you see in various places the scarcity of PPEs. Fortunately, in Gambia, with the help of the Almighty Allah, since the pandemic started, we've not had an acute shortage of PPEs. We got reductions at various points in the supplies. There was a time that we had reduction in the number of gloves we had in country, so we had to use them very judiciously. But we are happy to say that these WAHO donations include gloves and other PPEs as well. That is why it is very important for us to come back to indicate that they are in these donations contain, some boxes contain gloves for the health sector. Thank you very much. Thank you.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland and the rest of the world with our safe, secure, fast and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
Man maa ngi tudd Sambou Diagne.
Kan mooy Sambou Diagne?
Sambou Diagne benn soose la mu ngi dëkk Farafeñe. Fankanta waxi soose la. Soo ko mën a misaale mooy espiawil ci moto. Su fekkee ne yaa ngi dem ak moto bi su moto bi yàqu tànk bi yàqu nga jëne espiawil bi posé ko mooy fankanta da nga fankandiku ci.
Comme que yow julit nga doomi julit bi nga demee ba ubbi lu mel ni motel dégguloo si dara.
Okay. Motel bi mo amuñ ci problème waaye nag restaurant bi baa bi daal lañu ne mbaaxul ci julit war ko doxal boobu bokk na ci li daane fankanta.
Suma laajteel yi xam naa ñu bari di neen jaaxle parce que si suñ société du ñuy faral di gis doomu julit di naan te ñu bari dañuy wax ne soo moomee lu mel ni baamba te it nga moom lu mel ni ay hôtel ak yooyu noonu fokk rek nga naan dang daan naan.
Man cigarette sax mosuma ko tuux ñun suñu bàyyi def ñu aaye lépp.